now, the health and care system in England has been described by regulators as gridlocked, with patients at risk because they can't get the assistance they need. The Care Quality Commission says more than half of patients are unable to leave hospital when they are ready because of a lack of support in the community. Alison Holt reports.
Whitby in rural North Yorkshire is one of many places feeling the impact of what the regulator describes as a gridlocked health and care system in England. This is one of just 2 nursing homes in the area. There is constant demand for them to take patients ready to be discharged from local hospitals to free up beds there. But the home's manager says they just can't find enough staff.
As of this afternoon, we'll have 16 residents. We can have up to 24, so we have a lot of empty rooms, but we are heavily reliant at the moment on agency staff, which have been fantastic, but I would be quite nervous about taking on any extra residents because we wouldn't properly be able to meet their needs.
The home was facing closure earlier this year, but the local council persuaded the current provider to take it on with some restrictions. Without this place, there would have been worryingly few nursing beds locally, and Joan, who's lived here for 12 years, would have had to find a new home.
I was very disturbed because it meant I was losing a selection of friends. I wasn't cross because there wasn't anything I could do except protest to whoever was listening. And that was nobody.
Today's report by the Care Quality Commission warns of alarmingly high staff vacancies in health and care in England, with 300,000 unfilled jobs, more than half of them in social care. It says 500,000 people are waiting for council care services, and 3 in 5 patients end up stuck in hospitals waiting for support in the community.
We recently brought together 250 leaders across health and social care who are currently operating out there in the system, and they described it as a system in crisis. They talked about unacceptable waits and ambulances, people stuck in hospital when they need to leave, and there is urgent action needed now to ensure that people can get the right support at the right time.
Are you ready for handover?
It's existing staff who have to fill in the gaps. Ken is one of 4 nurses at the Whitby home. They really need 6.
In the terms of the last 4 weeks, we've had people on annual leave, so I've been doing 60 hours. And you think I'm doing 4 night shifts and 2 day shifts. The only time off is actually a sleep day.
How long can you keep doing that?
Not long.
The government says its own plans for health and care address the priorities highlighted by the CQC, and that it's putting extra money into the recruitment and training of staff. Alison Holt, BBC News, Whitby.